Being here in a place that has traditionally been an incubator for innovation really makes you wonder what's next. In your mind, what innovations are we going to see coming down the pipe?
You know, having this conference is a game changer. We saw many places in the world started to think about how we can change the way the global health architecture is organized. And to discuss that, we need to bring people, we need to bring minds, we need to bring innovation on the way we are delivering our programs. And I think this conference is discussing about so many innovations. Yesterday, we saw people discussing about artificial intelligence, how it can change things. We saw people discussing about how the climate change is affecting and what we can do to overcome this challenge. We saw people talking about a number of areas in terms of global health care. I really believe that there is a future for this kind of conference, the Abu Dhabi Global Health Week. And for the first year, I see there are 5,000 people. In Africa, last year we organized also a similar conference, and we are building now the bridge between Africa and Abu Dhabi for our conferences. Yes, there are some lessons from COVID, especially in Africa for us. We didn't have access to health commodities when we wanted to have it. This is why we are pushing for this agenda of local manufacturing of health commodities in Africa. This is a must. This one is not negotiable for us. Building this local manufacturing agenda, it's for health security, it's for economic growth, because we are talking about a market of 50 billion US dollars per year. It's for job creations. It's also for peace and security, because people, they will have access to product they don't have to run to another country to have access to that. You saw how many people are migrating to other African countries just to have access to medicines. That one will stop.
Yeah. One of the themes of the conference, obviously, is this shift from healthcare to health.
Yeah.
In your mind, does this disenfranchise the continent? Because already you're behind when it comes to Western standards of healthcare. Mm-hmm. Or is this an opportunity to leapfrog?
It's really an opportunity. We are talking about the animal health, environmental health. We are talking about mental health. We are talking about all components of health. This is why I like with this the theme of this conference, because as Tedros, the Director General of WHO, said yesterday, this is what we need to start to talk about, moving to really have this global health component targeting, all components.
What do you see as the greatest challenge to doing that?
The main challenge is, how are we coordinating all of these programs? What are a clear plan that each country can put in place, and we at Africa-CDC will support all countries to put in place plans. When we talk about climate change, we need to have what we call the One Health approach. It means we need to have animal sector sitting with human sector, sitting with colleagues working on the environmental sector to build a surveillance system, to build mechanisms for them to work together and to
an ecosystem.
And on top of that, we need to have communities involved, because you can do everything without communities, you are not going anywhere. And that one is our major challenge, how to link up all sectors and community to support that by building the system with appropriate health commodities, appropriate funding, and appropriate coordination mechanisms.
It's been great speaking to you. Thank you so much for joining us here at Abu Dhabi Global Healthcare Week.
Thank you so much to you.
Thank you.